right, thanks families for joining us today. Our special guests are some folks from Alliance Health, and Ashley Bass Mitchell and Deneen Hinton are going to share their information about their program, and then we will have a time for questions. So Ms. Deneen, do you want to introduce yourself first, and then we'll go on to Ashley?
Sure. Hi, everyone. My name is Deneen Hinton. I'm the Community Education Specialist at Alliance Health. I've been working at Alliance Health since 2012 when we became Alliance. We were formerly known as the Durham Center. Alliance is the managed care organization here in Durham. We cover 4 counties, cover Durham County, Wake County, Cumberland County, and Johnston County. My area of service is in Durham. And I have 3 other counterparts that service to Durham. My job is to educate the community. I'm a community person, so I go out and I do community trainings on mental health, substance use, and intellectual developmental disability services. I encourage people to get connected if they are in need of supports and services. I do a lot of anti-stigma services, presentations, trying to get people to debunk this stigma and get people to reach out and get the help that they need. We have, at Alliance, we have a lot going on right now, particularly now since COVID-19. Things are a little different, but that hasn't stopped us from providing the supports and services that we have been. We just do it a little differently now. We service individuals from the age of 4 years old until adulthood. So you can, up to 100 years old, we have supports for individuals, no matter your age, at least as long as you're at least 4 years old. And we have resources that we can share with folks who have young people younger than 4. A lot of times it's Department of Social Services or Public Health, Department of Durham Public Health agencies. So what we do is we contract with providers. We have roughly in Durham over 200 providers that we actually pay to provide the services. We're like the umbrella. We're like the governing body of services. So we contract with the providers to provide outpatient therapy, in-home services for children. We call it intensive in-home. We have, and that's adult and children in-home services, community support services. I think I'm med management. So if you need to see a doctor, we have right now is telehealth. You can see a psychiatrist for your medications. We have outpatient substance use services. And we have this new service for our IDD population, and that's our traumatic brain injury. TBI waiver services. So that includes home services as well as a case management component to that service. So we have other things that we do. As far as with children is concerned, primarily, I want to talk about our kids in crisis. And when I go out and I do trainings and I talk about warning signs to recognize in young people that may be experiencing a mental health crisis. So we have this wonderful brochure I like to share with, and just send you a lot of them, Sydney. And it's watch for the warning signs. What do you watch for when a young person is behaving differently than normal? Their attitude may change, their sleep patterns may change, their thoughts may change, and it may be withdrawn. What do you do? How do you approach young people? One of the biggest things, service that we provide, or I actually am a mental health first aid trainer, and it's a youth mental health first aid trainer. We have adult mental health first aid trainers and youth. And that's a 8-hour course that anyone can take. Anyone who's working, any adult who is working with a youth can take this training. And like I said, it's an 8-hour course that teaches individuals how to help someone, how to help a youth that is experiencing a mental health crisis. Okay, how to recognize the signs, how to get them to the most appropriate help. And this could be, and we do a lot of the trainings in churches. They have youth ministries, schools, different youth agencies such as Girl Scouts or Boy Scouts. So we can go wherever you need us to go. We can go into your facility, your agency, and provide the training. There used to be a time when this was free, but it's not anymore. But it's a very minimal cost of like $20. Now since COVID, we are not able to go into facilities. We actually, I'm in the midst of training virtually. Now, as far as adults are concerned, we have programs that offer assistance, financial assistance. Yeah, Independent Living Initiative. Yes, thank you, Ashley. And that is a program that provides rental assistance and utilities assistance to prevent eviction and to prevent utilities from being turned off. And we also have funds to help with deposits, first month's rent and deposits to get into an apartment. Along with that, we have supportive housing funds. So say, for instance, you are part of, we have these programs, it's called DASH program. And other agencies, other public agencies actually have the same type of program, but they're just called something different. At the Alliance, it's called the DASH program. And once you qualify for a DASH program, you receive a housing voucher. And that voucher allows you to go and look for scattered housing, apartment, or house, and we will assist with the rent as long as you need us to. A lot of times we encourage people to get what used to be called Section 8, now it's called Housing Choice Voucher from Durham Housing Authority. Once you receive that, then you can move out of our program. But it's supportive houses for people who are connected to services. They have to be receiving some type of services through Alliance, enhanced services. So that's outpatient therapy, or that's community support services, or an ACT team. That's a really good program to have. There are limited spots for that. So not everyone will be able to receive that. As long as we have openings or we have funds, we can actually bring people in to receive that service. I want to talk about our crisis. We contract with Durham Recovery Response Center, which some people may know it as
Crisis Response Center.
It's the response center now.
Oh yeah, they were on with us last week.
Okay, the Crutchfield location. Oh, so you're familiar with them. Okay, it's over there near Durham Duke Regional. And we contract with them for people if you're experiencing a crisis. It's a 24-hour walk-in facility. You can go and seek services if necessary.
So hi, I'm Ashley Bass Mitchell. I am the System of Care Coordinator for Durham. I have 3 other counterparts. As Denise mentioned, we have Johnston, Wake, and Cumberland that Alliance covers as well. And I am the System of Care for Durham. And so what that means is I'm kind of the bridge. I try to help provide services. A lot of people call me the email lady because I send out a lot of the resources that's available within the community. I try to collaborate and build relationships and kind of share what's happening throughout Durham as it relates to whatever is happening at that particular time. Currently, it's the pandemic, and then there's been things as it relates to mental health, substance misuse, and intellectual developmental disabilities, things of that nature. I also staff the Durham Community Collaborative, and so I help to kind of I staff it in that, along with their 2 co-chairs, a family and agency co-chair, because the collaborative is for everyone in Durham. And so all are welcome, especially, we welcome youth to come, we welcome families to come, we welcome agencies, providers, everybody to come and participate in what's going on. And they have a set goals that they're trying to accomplish each year that changes. And so as we're closing June, we are also closing the fiscal year. So we'll come up with new goals for the next year, and we work together to kind of decide what's pressing this year, what's something we need to work on, how do we increase membership and things of that nature. With the collaborative, we try to do ways to get community involvement and ways that we can engage and go out into the community for our quarterly events. Obviously, during the times that we are currently under, things will be a little bit differently, but we still want to maintain engaged and with the community. Along with that, I help to put on like cross-agency trainings and trainings in general to kind of offer, connect with and partner with agencies and programs throughout the community to talk about the work that they're doing, answer questions, kind of put a public forum together for community and providers to be able to ask questions, gain understanding about how systems and things work and what they need to do to be able to kind of connect to the resources and systems that families are in need of, and also how those systems providers and organizations can connect to families as well. What's the best way to get involved? What are things that could be done better? How can we, better engage people? What are some positive or feedback that we can take to to always do better, and be better, because a part of system of care, one of the main focuses of system of care is youth and families are full partners in not only their own learning, as they grow into whatever their idea of what success looks like for their family to overcome the challenges that they're facing. So I kind of help with that and just kind of be that bridge to be able to support however available. I am in Durham. I am not the person that does care reviews, but I assist with that when needed or jump in the other areas. Typically the system of care coordinator will be the person to do that, but Durham is unique as it has its own person to be able to do that. But we work closely together and support, and when people are in need of resources or things of that nature, they come to me and we tag team together. Along with that, I offer Flex Funds to families that are in need. And Flex Funds is a program that is put out there for youth that are 21 and under in need of services to help support the goals that they're trying to accomplish in their care. So if one of the goals is like social skills, and maybe they need to go out to the YMCA or go karate was a big thing last year, or things like that in schools, they may need support in getting a class or something for a school. Flex Funds can cover those different things as long as it helps that towards that youth to be able to achieve and accomplish their goal according to what their plan goals are. And it is only for youth. It is not for like services for rent utilities or anything like that. It's specifically for that youth to be able to engage in a service and in a program that fits whatever their needs are. I work closely with the community. I kind of am involved in, in collaboration when there's partnerships that need to kind of be made, or I can lend a hand. I work with other community partners, and they work with me. So we all kind of come together to a variety of events, be it a, community health fair or community fair itself. We've done luncheons at the Nehemiah Center to offer support where it relates to like different not Medicaid, but just anything that people are in need of, be it housing information. Medicaid transformation was the big thing last year. Raise the age, all of those different things that come about. I'm kind of the person that helps put those things together, offer facilitation services, and support however I can.
I thought we did a lot. So actually, I'm just going to go ahead and jump to questions because I thought of a few while you guys were introducing your programs and yourself. So have you seen an increase in service requests since COVID-19?
Yes, I have. They, families are just kind of trying to figure out what to do. We do have the Hope for NC line that is out there now, and so that families can get the services that they need. And so families and providers, we have the Hope for NC line, which is a 1-855-587-3463 number. And that's for mental health, resiliency, just support for anyone. However, there's also a Hope for Healers line as well, which that number is 919-220-002, which is for providers that are offering services and, the frontline workers that are doing the work. Everybody's doing their part. Don't get me wrong. I want to make sure I state that because I think it's important to say. But, for those frontline workers that are doing work every day, the hospital care and things like that, the janitors, everybody, whoever is doing it, that line is specifically for them because, they're doing that work, the work that they're doing, and may get burned out and maybe in need of different type of services and support. So those two lines are available, and the system of care coordinators are actually some of the people that are staffing that to be able to offer that support to those in need. And then families, what to do, because some of the youth that were in school had IEPs and different types of services that they were in need of. Trying to figure out how do I transition that now that they're at home? How do I support the family now that we're at home? Getting that information about food resources, getting information about, housing, and, what's the law say right now about not being able to be convicted if you're in a hotel or if you're at home, like, what does that look like? So just kind of people feeling like they just need to know what their options are because it's a little bit different than what it was prior to the COVID pandemic.
Yeah, I don't know how we would be functioning without the internet.
Yeah, no, we couldn't.
Like how people would be getting support and how we would do our work. I mean, I can't even think about doing this 30 years ago.
No,
Right.
It would just be crazy.
my work has slowed down considerably because I'm a community person. So my job is to be out in the community. I do a lot of health fairs, resource fairs. And so that has come to a complete halt. So I'm not able to do that. But what we have started offering is just Zoom virtual trainings, mental health 101 trainings, substance use trainings, any topic you can think of. If we don't have the information PowerPoint presentation, we will create one to make sure that people get, still get the information and the resources that they need. But it's been really difficult trying to be creative on
Yes.
how to do the same work at home.
Yes.
Not
Yes, because we are not a work from home agency either.
not.
So
Yeah, right.
all new to us. So do you have resources available in Spanish?
Yes.
Okay.
Our training, well, I won't say the actual trainings that we provide. We don't. We do have a Spanish version of mental health, youth mental health first aid. I'm not a facilitator, but we can. They're nationally. And the one positive thing about the virtual training is that we can reach out to people on a national level to do it. Before we couldn't, have someone from Michigan to come down and do the training, but now we can just say, can you, if you're available, provide this training to someone in Durham, which is a positive. So we have Spanish versions of both actually trainings, but some of our other in-house presentations that we have created, we can do it if we have someone that can translate and that can actually do the training.
So as far as the resources for housing, you have that available
We
in
have
Spanish?
brochures, flyers, information,
It
all
was in
everything.
Spanish.
Yeah, everything, all the flyers and different brochures we have and we have in Spanish. Yes.
Okay. And then the last question I had, so all the programs that you talked about, are those available in all of the, was it 4 counties?
Yes.
Okay.
Yes.
So we'll make sure that we get your contact information posted on our Facebook page, and then I'll verify the help numbers that you gave me just to make sure that I got them
I
right.
was trying to find the flyer. Ashley, do you have it? I can just send it to you. I have it. I can send it to you, Cindy.
Yeah, anything electronically I can
Okay.
convert
Yeah.
and post
Yeah.
to the Facebook page
We
too.
have both Spanish and English. Mhm.
So yeah, I
Do you
take
want me
all
to
of
share it
Ash.
here?
Go ahead.
Can you share it?
I have it. You want me to share my screen here? Am I able to share it?
I don't know if you can share it.
You should be able to now, Ashley.
Yes, there it
There
is.
it is.
And
Perfect.
that's also in Spanish. If you have, do you have that version? That
I don't have the Spanish one.
Okay, I do. I have the.
So hang on, I can make, Deneen, let me make you a
Oh,
host
okay.
as well. Then you can
Okay.
share.
And I'll stop sharing so that you can share the Spanish version.
Okay. Hmm.
Can you zoom out? There
There you go.
Okay.
Perfect.
Alrighty. Great. All right. Now go not do it. Stop sharing. Okay. All right.